depression is actually, it's one of those things where there's a list of symptoms and you need a certain amount of these symptoms to qualify for clinical depression. And in all honesty, that shows up in many different ways in many different people. I think the Western version of depression is somebody who is in bed, sleeping all the time, crying all the time, especially with women, eating a tub of ice cream or somehow emotionally eating. And that is one way that some people express depression, but it is multifaceted. Depression is a condition where there is this distinct loss of pleasure. So the things that would normally have brought you pleasure in your life, they no longer bring you pleasure. And so that can be anything, right? And in addition to the loss of pleasure is a distinct change in mood, and not just, again, not just a momentary, oh, I had a bad day, or I had a bad 2 days, or you're not reacting to an actual situation that's difficult. So this is either lowered mood or irritability, especially in kids. And sometimes, not to overgeneralize, but from a cultural gender perspective, males. So kids and adolescents and males tend to be more irritable, but there's many women who can also be irritable as well, and sometimes some men are sad and weepy. So what I'm trying to say is that it can come out in many different ways, but those two, the loss of pleasure and this distinct lowering of the mood for at least 2 weeks and consistently is kind of that's a telltale sign that something's wrong and needs their attention. And then there's some other symptoms that include loss of appetite or too much eating, not sleeping well, sleeping too much, lowered energy, slowing or agitation. So that's what I mean. It can show up in many different ways, but it is a condition. Numerous research and empirical studies have linked the experience of depression and anxiety. It's hardly ever one person is feeling a clinical depressive episode and not having some anxiety intermingled. And one way that I've learned, and I'm looking at this from a trauma-informed lens, which may or may not be mainstream. It's getting more mainstream, but I can't speak to that. But in a trauma-informed lens, one can also view depression and anxiety as kind of the nervous system is either hypo-aroused, which is not aroused enough, or hyper-aroused, which is aroused too much. And so if our nervous system is in any one of those spheres too long, so hyper-aroused is a more agitation in the anxiety land, then our bodies can't take that amount of stress hormones, and so there is kind of a breakdown and a crash, and so you get into hypo-arousal.